Calcium is an interesting extracellular cation because it is involved in so many processes in the body. It's involved in nerve impulse transmission. It's involved in bone structure. It's involved in muscle contraction. So calcium has its hand in kind of everywhere. It's stored in the bones, but I always think of the bones as being like a checking account. So savings account, like you just let it build up and use it in an emergency or whatever. With a checking account, you're always spending and replenishing it. So the bones are like your calcium checking account. You're always spending and replenishing calcium in your bones. So you're always breaking down and rebuilding bone, which is why bone is such a changeable tissue. It also has a great blood supply, so you can do that sort of thing. So calcium and phosphorus and other minerals are stored in the bones. So calcium is an extracellular cation, so there's more of it outside the cell than inside the cell. It's ingested in food and it's stored in the bone and it's excreted in urine and feces. The balance of calcium is controlled by the parathyroid hormone and calcitonin. Vitamin D promotes calcium absorption from the intestine, so from your food, basically, through the intestine. So vitamin D is either ingested or synthesized in the presence of ultraviolet rays. If you live pretty far north, like Washington, you might not get enough ultraviolet rays to synthesize vitamin D, so you might need a vitamin D supplement. And calcium is vitamin D is activated in the kidneys, and it's necessary for calcium absorption. So that's something that you can talk to your doctor about whether or not you need a vitamin D supplement. But a lot of people who are admitted to the hospital in Washington have low vitamin D, which means you probably have low calcium too. I don't know, but it's interesting. The calcium and phosphate ions in the extracellular fluid have a reciprocal relationship. So if calcium's high, phosphate is low. Um, Phosphate is involved in some of the buffer systems that help maintain our acid-base balance. So it's all interdependent. Everything depends on everything else. Just pretty interesting. So calcium provides structural strength for bones and teeth. That's pretty important. It maintains the stability of nerve membranes. That's pretty important. It's required for muscle contractions. I will refrain from commenting on the importance. We'll just say that calcium is pretty important. Calcium is also necessary for a lot of metabolic processes and enzyme reactions. And it's essential for blood clotting. So we have to have that supply of calcium all the time in order to do all those very important things. So hypocalcemia, which is low calcium in the blood, it can be caused by hypoparathyroidism, because remember, the parathyroid hormone regulates calcium metabolism. It can be caused by malabsorption syndrome. So maybe you can't absorb calcium through your intestines. It can be caused by deficient serum albumin levels, increased serum pH level, or renal failure. So kidneys have their hand in everything. Kidneys are a linchpin for our metabolism. The effects of hypocalcemia are increased permeability and excitability of nerve membranes. So you might get muscle twitching or what they call a carpopedal spasm, which is in your foot. And it might cause muscle tetany, which another word for tetany is cramps. So if you have low calcium, you might get cramps. It can also cause weak heart contractions, which that's not good. Or delayed conduction of cardiac impulses. It can lead to dysrhythmias and decreased blood pressure. So hypocalcemia is pretty serious. Hypercalcemia can be caused by uncontrolled release of calcium ions from bones. This is often the case with malignant bone tumors. So that's pretty serious in and of itself. Hyperparathyroidism, just the opposite of hypocalcemia, Demineralization caused by immobility, decreased stress on the bone. So if you're immobile, then your bones will say, "Oh, we don't need all this. I don't need all this calcium. Get out of here," and your bones will get weaker. Or if you go to the International Space Station and you're no longer subjected to the forces of gravity. So in the olden days, when astronauts would go into space for a couple of days, they would land, or land in the water usually, and then the aircraft carrier would go to pick them up, and they'd go be helping them out of the capsule, and they'd look all sort of debilitated, but they'd be helping them out of the capsule, and they'd walk out basically. Well, now when people go to the International Space Station, they go for longer, for one thing, and then when they come back, they actually carry them out strapped to backboards just so they don't accidentally break a bone on the way out. Isn't that interesting? Because they get demineralization caused by lack of exposure to gravity. Increased calcium intake can cause hypercalcemia. Excessive vitamin D or excessive dietary calcium can do it, or something that's called milk alkali syndrome, which we won't go into the details of. The effects of hypercalcemia are the opposite of hypo. They're depressed neuromuscular activity. So muscle weakness, loss of muscle tone, lethargy, stupor, personality changes, anorexia, which is loss of appetite, and nausea, which I think we all know what nausea is. Interference with antidiuretic hormone function, so you get less absorption of water and decreased renal function. And increased strength in cardiac contractions. So with hypocalcemia, we had weaker cardiac contractions. Hypercalcemia, we have increased strength in cardiac contractions, and that can cause dysrhythmias, which can kill you. So hypercalcemia is pretty dangerous. Magnesium and phosphate. Magnesium is an intracellular ion. Hypomagnesemia can result from malabsorption or malnutrition, often associated with alcoholism. It can be caused by use of diuretics, it can be caused by diabetic ketoacidosis, hyperthyroidism, or hyperaldosteronism, where you have too much aldosterone in your system. Hypermagnesia occurs with renal failure and depresses neuromuscular function and decreased reflexes. So that can affect a physical therapy session. Phosphate is a player in bone and tooth mineralization. It's important in metabolism because ATP, the P in ATP is phosphate. So we get the energy from ATP by breaking off one of those phosphate groups, and we get energy from that. There's a phosphate buffer system that is involved in acid-base balance, which we'll talk about in the next section. And phosphate is an integral part of the cell membrane because if you recall from previous classes, the cell membrane is a phospholipid membrane. So there you go. It's the lipids on the inside, the phospho on the outside. There's a reciprocal relationship between serum phosphate and serum calcium. So if one's high, the other one's low. Hypophosphatemia is usually caused by malabsorption syndromes like Crohn's disease. It can be caused by diarrhea or excessive use of antacids. Interesting. And hyperphosphatemia is usually from renal failure. So hypermagnesia and hyperphosphatemia are usually from renal failure. So renal failure can do a lot of terrible things to your balance. So chloride is the major extracellular anion, and when it's in a non-dissolved form, it's usually hanging out with sodium chloride. Chloride levels are related to sodium levels for obvious reasons. Chloride and bicarbonate ions can shift in response to acid-base imbalances. Hypochloremia is usually associated with alkalosis, which is too little hydrogen ions, not enough hydrogen ions. What I'm trying to say. So early stages of vomiting, because you lose hydrochloric acid from your stomach, and so you lose chloride. Um, hyperchloremia can be caused by excessive sodium chloride intake. So go easy on those Doritos for the chloride imbalance. So these are our reference values for electrolytes. So sodium is usually pretty high in the blood, 134 to 142 milliequivalents. I've seen lots of people admitted to the hospital with low sodium. Potassium between 3.7 and 5.1, so pretty narrow range. And you can see the other ranges. Fluid electrolyte disorders are among the most common clinical problems that are encountered in an acute care setting. So a lot of people they're serious enough that they admit you to the hospital. That's kind of the takeaway from that. Electrolyte imbalance is important for nerve conduction, muscle contraction, cardiac rhythm, bone health, blood coagulation, and fluid balance. So all that stuff is super important. Sodium and potassium. Abnormal sodium levels can lead to neurological consequences such as seizure disorders. Hyponatremia is the most common electrolyte abnormality by far. Lower sodium levels are associated with cognitive change, especially regarding memory and executive function. So if an elderly person is exhibiting memory losses and executive function, it might be because they're hyponatremic. Abnormal potassium levels can high or low can lead to cardiac arrhythmias, which can kill you. That's not good. Therapeutic intervention, so for physical therapy, is safe in patients with potassium levels between 3.1 and 5.9. If they're outside that range, then you shouldn't be doing PT with them. So calcium, like we said, it's essential for the proper functioning of muscles, nerves, and the heart, and for maintenance of bones. Chloride helps regulate the amount of fluid in the body and maintain the acid-base balance. And usually they order a chloride test when acidosis or alkalosis is suspected. Phosphate is important for energy production because of ATP, muscle and nerve function, and bone growth. And it also plays a role in acid-base balance as part of one of the buffer systems. Magnesium is important for energy production, muscle contraction, nerve function, and the maintenance of strong bones.